We are going to talk about designing empathy, and I talked about this earlier in my intro around it really being full circle to where we started in the morning around the human factor. And I think Carl spoke to that a little bit as we got into the end part here is you actually have to have people that's understanding, analyzing, operating, making decisions, choosing, deciding risks, mitigating all the issues to be able to really maximize and optimize the power of AI. So let me welcome to the stage Renee Nan, Manager, Planning and Performance for Region of Peel, as well as Andy Sato, Service Experience Advisor, Region of Peel. They're going to join us. There is a presentation that they're going to go through around how customer insights build more inclusive service, designing with empathy. Thank you.
Everyone from cocktail hour, so we'll try to make it entertaining. Shall we?
We will definitely try. So today we're speaking to you about designing with empathy. And coming from the region of Peel, which is a very, very diverse community, if you know anything about it, we are 1.5 million in scope in terms of citizens. We also are one of the most diverse communities in Peel. We're an upper tier municipality. We house Brampton, Mississauga, and Caledon. So the work that I do with the region of Peel is I'm Manager of Planning and Performance for Peel Regional Paramedics. And Andy?
I lead our Customer Experience Office. And Renee and I have worked together on and off for like 13, 14 years in different roles. We both started in the contact center many years ago. Prior to Peel, you were with?
Ontario Lottery and Gaming. And you?
I was with Hewlett Packard. So private sector, kind of quasi-public, I guess, public sector.
Corporation, yeah.
Yeah. But different roles within Peel today, but still both very interested in working within the customer experience space.
He can't get rid of me.
No. You covered this.
Okay. So, as I was saying, 1.5 million citizens. We're a very, very busy municipality. It's incredibly diverse in Peel. So, 69% of the residents identify as racialized. That's increased now to 72% since the last census. And we're talking different languages, different religions. So, you can imagine trying to deliver all of the services that we actually deliver to our population. It can be incredibly difficult, and we welcome newcomers on a daily basis. Peel, as you know, houses the airport, right? So people are stopping here immediately. And when I think about Peel Paramedics, the amount of calls that we actually get to Pearson Airport, and you're dealing with newcomers a lot of times that don't even speak English, you can just imagine how complex it is. It's a very young community with an average age of 39 years old, right? So you're dealing with newcomers, growing families. The household size in Peel is usually 5 or more. So if you know anything particularly about Brampton, you'll hear a lot of stories about these houses that house multiple families and growing communities. So here we have just in terms of some numbers about population by birthplace. So you can see here it is incredibly diverse. And again, that makes it very complex for us to deliver these services. You can speak.
So how do we have 5,000 employees, and how do 5,000 employees, which is a lot, but how do 5,000 employees deliver over 100 distinct services to 1.5 million people and to make it successful? So the answer is in the presentation title, and that's empathy, which is very topical today. Heard a lot of people talk about empathy, which is wonderful. It's been in the news lately. Elon Musk called it the greatest weakness of Western civilization. So we are clearly the weakest people in the room on a mission to move away from the way we approached service design in the past to including the customer voice and including much more empathy in how we build, refine, and improve our services. So we'll start with kind of the past, and also sometimes still the current, I guess. Like, we're still guilty of designing without empathy. I think we kind of all are. I've got a joke for you.
Okay.
What's the difference between ignorance and arrogance?
I don't know.
I don't know, and I don't care.
Ooh.
That's terrible.
That's good.
Yeah.
Good dad joke.
You can talk about ignorance.
I'll talk about ignorance, that's fine. So a lot of times, right, as a government service, we think we know all of the answers. We're not engaging with our community. We know, like, we consider ourselves the residents. We're acting by proxy, and we're saying, well, I don't like this, so this person must not like it either. And that's, I think, Andy, at like the region, how we were doing things for a very long time. Also, we like to consider ourselves very smart people, right? So when we're designing services and we're doing communication plans, we're using like really highfalutin words and not being accessible to the community, and especially, as I said, Peel being so diverse, it was just not landing. People didn't know what the heck we were talking about. Like, we're talking about synergies and this and that, and it's going into our strat plans, and nobody had an idea like what we were saying. The cultural differences in Peel are significant, right? So even amongst different racialized groups, then you have different groups of religions, different cultural sensitivities, differences when you're talking, gender. So again, that made it really, really complex. And we made it really super hard to provide feedback. So again, we had this multi-layered website that was pretty hard to navigate, and then finding like the button to actually submit feedback wasn't the easiest. And once you did submit the feedback, like, where did it go?
And sometimes we knew better, but we still designed things in a particular way. So it might be that we required a particular form to be printed and submitted by fax. And dirty secret, we still have forms that have to be submitted by fax today, right now, which is incredibly embarrassing. Or setting unrealistic expectations, like saying we'll get back to you in 15 business days, which is not acceptable to anyone. And guaranteed, if we say that, someone's going to be calling us or emailing within 3, which is what their expectations are. And another thing, which is a bit of a spoiler, is providing services based on political directive or a council resolution that says, here's a great idea, please implement this.
Yeah, so for those who don't know, we actually have to report into council, right? So councillors, they're elected government officials, and they like a good platform. So often we are at the whim of council directives, and that can always be fun and interesting. So what are the consequences of poor service design? And I touched on a bit of it. So we're using confusing terminology. We try now, in terms of AODA compliance and just accessibility in general, to be at a grade 8 reading level across all of our platforms. We weren't considering how some of the questions were being asked. So if English isn't your first language, some of our phrases and terms that we were using were not, again, landing. And what does that drive? That drives phone calls, because, again, you're not understanding it. We had tons of broken links, tons of dead pages that hadn't been updated in eons. And again, we're going to transferred calls because people are now calling the call center to find out, when's my garbage being picked up? And that should be something that they're able to find very easily on the website, but because we weren't spelling it out properly, it just wasn't working. Inaccessible PDFs, so you generate your PDF and you go to fill it out, and it's just not working. And we had a lot of staff, we try to do first level call resolution, and sometimes that was generating calls to the second tier. So you've called now, you've waited to get online, you're speaking to someone, and then only to hear you're going to be transferred, right? So that can generate a lot of poor customer experience feelings.
This is all very depressing. But wait, it gets better. It gets better. But before it gets better, it gets worse. Because I'm going to talk about rats. This is a fun one. This is an example of a service that was designed sort of in that old lacking empathy way. So really quickly, it was a council directive. Post-pandemic, they said, rats are a problem. We need to do something about it. My office is getting lots of complaints. Here's a resolution. Here's some money. Please go eradicate rats. And so our staff created a program based on this council directive to subsidize homeowners, to cover some of the costs to hire a professional person to do rat abatement in their homes. So the program was it was implemented as it was directed, and the outcomes of it are not surprising that it was not successful. We did a pilot. And at the end of the pilot, only 28% of the budget for rat subsidy was actually spent. And went back to council and said, this isn't working. This is probably the service design. We've done communications, people are informed, but there's just, people aren't applying. There's not a lot of interest in it. Council said, try harder, do more communication. Here's more money for more communication. So we flooded the market with communication. Surprisingly, that didn't work. The communication wasn't the problem. We actually had 1.5 million impressions across our entire comms campaign. It was buses, bus shelters, digital billboards, buck slips in water bills, social, everything. And in the end, we only had a few hundred people. What was it there? It was, 800 people or so received the subsidy. They had an average subsidy of $173. And the program cost $600 and something thousand. So it cost about $800 per subsidy. And that's the story of that. What happened there? It was the loudest voices in the room that complained to their counselors who were heard. The counselors then basically designed the program for staff who implemented it as they were told. Nobody asked the customers, nobody asked our residents, how would you like help with your rat problem? There were a number of things. You had to use one of our approved companies. You had to apply using a PDF. You had to apply after you paid. So there's a lot of decisions that could have been made to design that better. And empathy definitely would have helped.
So, funny tidbit, Andy is an alumni of working at Disney, so the rat slide was really fitting for him. So why design with empathy? So as you saw in that rat example, if you do not design with empathy, you're going to waste a lot of money because people you won't have an uptake of your service, right? And are we actually providing the right service? So, a bunch of people that wrote their counselors to say, like, we're being overrun with rats. They were the loudest voices and they got heard. But that's not necessarily everyone's experience. Those were just the loudest people. Empathy helps you understand the problem better and it helps you to find a better solution. So why it's practical? It's not just an ideology, and I think that's where people tend to get a bit confused, right? So we know there's this whole fear around like DEI principles, right? Thankfully we're in Canada, so it's less. But I think, at the region, we really do try to embed that into our work. So it's about meeting customers where they're at and inviting them into the space and not just leveraging them on like one-offs, right? So when we think about our citizens, we can't just invite them in for one conversation about one topic. It has to be an ongoing relationship. And we have to really understand, what data are we collecting? How are we going to use it? Helping employees understand that we don't have all of the answers, right? Like, again, we cannot be the actors on behalf of community and dictate to them what they want. And again, if you do design services in partnership with community, in partnership with your staff, you get better uptake on both sides, and that will result in a better services experience.
So how do we do it? What are the tools? Our approach now, we typically, if we're designing a new service or looking at an existing one to improve outcomes, we will still typically start with secondary research. We do that because it's readily available, it's cheap, it's fast, it gives us a really good starting point, but we don't ever stop there. So we'll pull process maps, transaction, any sort of data that business area is collecting today. Because Renee is within paramedics in the business area. In our customer experience office, we're an internal service provider. So we are not part of the business. We can only rely on what they give us internally, and they're the experts. So we collect all of that data, but with the caveat that all of this data is typically incomplete, it's outdated, and it's often biased. And it leaves out the customer. So we do primary research, and lots of it, as much as we can. We do it in 3 ways: observation, interviews, and surveys. And those are in order. That's intentional. So we start with observation. Observation is, in our opinion, the best place to start. Observing what people do, how they act, what they don't do is very powerful, especially when we don't understand the problem. And all too often we jump to solutioning before we even understand the problem. So we can't really design a survey if we don't know what questions to ask, and we can't do a survey of 10 open ends and expect to get good data out of that. So some examples of observation that we've done in the last little while. Digitally, we did an information architecture exercise when we rebuilt our website last year, and we did tree jack testing with customers. So we put them online, we give them a wireframe version of our site, and we say, you are this persona and you're trying to do this task. Go. And we watch them do it and see who succeeds and who fails. And in the example there, most people failed. So that was something that we knew that we had to change. Another example is much more interesting. It's in the physical space, and that's wayfinding. So we have a lot of physical spaces. The photo there is from our Seniors Health and Wellness Village. And like any healthcare type facility, it's very complex. It's got different sections that need to be secure for various reasons, but you also need to get people around. So we just go and we stand there and we watch our customers and we watch the patients and the residents of this facility get lost or found or ask for help. We talk to them, we talk to the staff, we talk to the cleaners, we talk to security, and we observe how people are using the space and then take that back to make improvements. Another thing we do is interviews. And interviews are great because you get to meet face to face. It requires empathy, it builds empathy. We love to bring the business areas into interviews, at least if they can attend it in person, that's wonderful. If not, we'll record where we can so they can see their customers in person. And then we share the data. So for example, of course, we're all CX experts. Customer journey mapping is a classic tool, and it's a great way to share interview data. And the example there, that was when we were doing ambulance call reports, which is one of Renee's areas. And we were looking at the current state of our ambulance call report online request. And then lastly, the classic. You want to do surveys?
Yeah, surveys, so fun. We just did one, right? So although they can be tedious, that's the perception. And in the region, let me tell you, we do a lot of surveys because we've got so many program areas, but it's such rich data that we get, and they're cheap. It's an easy way to get the answers that you need. But like at the region, we became over-reliant, right? Like imagine you're paying your water bill, you might be a user of TransHelp, you might have a loved one in an LTC, and you're getting surveys for all of these things, right? It's just saturation, it's overload. What we launched recently, because paramedics had never done this, they had never extracted this kind of data, we got a survey, and Andy was instrumental at putting it together, but it's actually being mailed out, like snail mail. But that is because in paramedics and in emergency situations, we weren't collecting any like email addresses. You might have a phone number, you might not. It wasn't very reliant on in terms of what we were collecting on the back end. So one thing that we did actually have were the addresses. So it's kind of groundbreaking work in emergency services to actually now engage with the users, because it's not really optional, right? Like they called us for a reason, but we need to know about that experience and not only hear the bad stories. There's tons of really great stories, but there's also lots of opportunities for lessons learned. So that's why we're launching this. And then we actually did battery containment online. That was an online survey. So it's really about understanding and helping our community understand like how to throw out batteries. So it was a huge problem, believe it or not. But it's just really about waste disposal and being environmentally conscious and educating our community and hearing about, our users' actual experience. And then the shelter survey is actually kiosk-based, and those are in our homeless shelters. And it's offered in languages that actually align to the users in the community that we're seeing appear at these homeless shelters.
And each shelter typically has a different assortment of top languages. We can't offer every language because it would be cluttered, but we talk to the shelter staff and say, well, what are the top 5 languages of the people coming to that particular shelter? And we program the survey in those ones so that we can reach as many people as possible. And the goal of the survey shelter is to find the drivers of satisfaction and what really matters to the people who are staying in our homeless shelters. And so far, it's food is one of the big ones. So go figure. As long as security is, like a 3, food is what we can tell the next biggest driver. It's very interesting.
And we pretty much all work in government to some capacity or with government, and believe it or not, people don't trust the government. So make the surveys anonymous, because there's this real big fear around retribution, or that I'm not going to get a service, or there's just that mistrust. So that anonymity, I went out for St. Patrick's Day last night, sorry. Being anonymous really, really helps in collecting that information.
Yes, and that's why we're using the kiosks in the shelters, and so far we are getting some very candid information on those surveys. Your paramedics one, you also included sociodemographic.
Oh yes,
right?
we're gonna touch on that
Okay.
quite a bit as well. But in paramedics, postal code collection in terms of address, that's been very, very telling, and it helps us to really understand the types of calls that we're getting that may not be emergency driven, but it helps us understand the demographics of the community and what types of calls are leading in those areas. And if you know anything about sort of like the fentanyl crisis and all of that, you can actually a lot of times pinpoint it to certain areas. So again, designing with the community. So our partnerships at the Region of Peel include 200 different not-for-profits that we fund. So having conversations with these groups that include the Peel Poverty Strategy Committee, Anti-Human Sex Trafficking Task Force, the Newcomer Strategy Group, 64 community agencies that provide everything from food, again, shelters, and help preventing domestic violence. These are community groups that we partner with on a daily basis. So when we're talking about designing services, they are the ones who are actually the end service deliverers, right? So we have to understand from them what their users are actually looking for. And so we collaborate on a daily basis. We're having conversations all the time. And it's really about how we, again, land these services and the end users are actually receiving them. Because in some instances, we're like the third party, we're the funder. So we don't necessarily get an opportunity to have those conversations.
One thing to note is that we use, say, like our Accessibility Advisory Committee as a wonderful resource for input on our digital accessibility. But we realized at a certain point, like, we can't use them as user testing and expect them to, like, hey, here's something, please test it for free every time. Like, their time is valuable. So that's something that we've come to realize, is that providing fair compensation, or at
Absolutely.
least an understanding that, these aren't unlimited free resources for us to just leverage as tools.
So funny story, so I'll get into this one, but I managed Peel Art Gallery Museum and Archives. And it was, for lack of a better term, like the collection was lily white. Like it was just European, and you're thinking about Region of Peel and how diverse it is. And we just had nothing in the collection. So we said, okay, like let's reach out to different communities and find out why they aren't coming. And like I knew, obviously, they weren't reflective, so they weren't coming. But it was when I was doing like one of the town halls with a diverse group, and they said, okay, so it's bad enough that you don't represent us, but now you want us to do free labor and give you feedback in terms of how to get people through the door. So that was very, very telling. So we've done some work, and again, I'll touch on this, at the Peel Art Gallery Museum and Archives, PAMA, visit it if you're ever in Brampton. We partnered with local Indigenous groups, and we actually wanted to understand how we could become an epicenter in Southern Ontario for learning and educating about indigeneity and really being supplemental to the schools. So we formed the Indigenous Sharing Circle, and again, these were groups who we partnered with previously, the Peel Aboriginal Network, but we brought people in and we said, tell us what you want to see. What do you want this to look like? What do you want this to feel like? We compensated them for every single meeting, and we were able to actually relaunch an exhibition called We Are Here that told the contemporary stories of Indigenous people, not just in Peel, but throughout Southern Ontario. And it will be launching further. But we also brought in the schools and asked them, what do you need to learn? Like, what more do you want to teach the students? And it was a really groundbreaking project. And this group has actually pivoted now to where they're advising the region on different matters from health to housing to different accessibility initiatives. We brought in the Black community as well for town halls. We try to partner every year with at least 2 new diverse voices just to hear how we can better serve.
One thing I'm very passionate about is customer stories, sharing all stories and quotes as often and as much as we can. We get a lot, obviously, from our observation and interviews and surveys. We hear a lot in the customer voice. So sharing those stories across the organization, I think, is critically important, even call center recordings. Sharing them internally with our staff and then sharing them externally where appropriate. No amount of data tells a story like customer quotes. So we've got stories that can lead to action. These are quotes where we have not done a great job. Most of these are probably from digital services. And it helps us design better digital or improve our digital or understand people's resources and preferences. Yeah, it's really powerful. I can tell a business owner that the language you're writing in is really confusing, but if I can show them 50 quotes that say, I don't know what you mean, what does next of kin mean? Then we can change that and not use a term like that, which is very much rooted in our own culture and doesn't translate well. But stories can also motivate, and it's really important we share the good quotes and the good stories, especially with the employees that were involved in building and delivering these services. So we get it to our frontline employees to understand that their feedback helps.
And touching on the employees, again, they're the ones interacting with our community, with our residents, with our citizens. So it's imperative that we actually listen to them because they're the ones who understand what the experience is, and we really try to leverage all of their insights.
And we're going to skip through.
We're going to skip through.
I'm going to skip past data.
Yeah, we'll get you to drinks.
Partners, yeah, we'll get to
Yeah. Go ahead.
Yeah, we'll talk about partners real quick. I'm sure all of you work with a lot of third-party developers, companies, consultants. There are lots who sponsor, and they are experts at what they do, but they are not experts about our customers and what they expect. So one thing we're very careful to do is to ensure that we're still embedding that customer listening when we work with our partners. So talking about the strategic plan where something was delivered that.
And we worked with a consultant and it was crap, so we had to kind of redo it. But you live and you learn.
Yeah. And build designs. So yeah, we'll skip through. Lots more to talk about, but you might have questions.
I think we want to open it up. I want to say this is a perfect way to kind of end the day for sure because you brought the heart back into what we're actually doing, and some of the work that you were describing here at Peel Region is amazing. Before we move on for the day, can I open it up to the audience, and do we have any questions? I have a question, right? Mike's coming to you. Don't be shy. There you go.
Hello, thanks for the presentation. I really liked it. I'm wondering, just a couple of questions, and there'll be a combined question, but it's kind of the same question. The customer experience office and the customer experience work that you're doing here, my first question, and I'll follow up with a second one, is how long has Peel Region been doing it? And then how did that come about, and where does it sit in the organizational structure?
Good question.
It's all Andy. Go ahead.
So it started just over 4 years ago, pretty much. Oh, sorry, 5. Pandemic. Yes, 5 years ago. Wow. And Michelle Orth back there was actually one of the originators of the pilot to create a customer experience strategy. We brought on a third party who created a strategy that we adopted and made our own, implemented that over 3 years, and then made the case to say, hey, everything we've been doing has been successful in showing ROI. Let's make this permanent. Built the case to make it a permanent CX office, which has now been in place for 2 years. And we sit within communications, which is in our corporate services area. Previously, we were in kind of IT, which is actually really good for the work we do. We do a lot of digital. And so because we have that history, we can straddle both areas and bring together these groups that need to work together to make the project successful.
Haley.
I have a question over here.
Sorry.
Right, on the right?
Yeah.
On the right.
Oh, sorry.
Yeah, no worries. First of all, I love what you're doing. This is really talking in towards agility and towards design thinking and towards like what really is what the problems that they have. One statement that you had over there was about people know what the services they need, therefore they know what solutions they need. But from my experience, more on products than service, people don't always know what's possible to do. And how do you see that, and have you seen examples of that where people told you, we need this, we need this, we need that, but then you came up with something innovative that was really creating a solution much bigger than they thought is possible?
I agree with you, by the way.
No, I
did
totally
we say
agree.
that in the presentation? Oh my goodness.
Oh, yeah.
Yeah.
Yeah, there was a slide about people know what services they need.
They know what the problem is and what they want, but yeah, taking their solution, that would be risky. Yeah.
Yeah, so I think one example that comes to the top of my mind is a lot of the work around sex trafficking. And so we were hearing this at the shelters, a lot of people basically coming in and being victims of sex trafficking and different issues like that. So I think the collaboration that the region has been able to do between shelters and hospitals and paramedics in identifying victims of sex trafficking and domestic violence has become even bigger than we ever imagined. So initially it was just kind of dealing with it in that emergency situation, and now we've got a comprehensive program that if a paramedic notices or sees these signs, they can alert the hospital, that then alerts the shelter, because we want this safe journey for the people that are involved in this. So I think that's one example where it has really, and I know it's kind of a depressing example, but it's something where we've exceeded what we thought the immediate problem was, and it provides more of a comprehensive solution.
Okay, thank you. And our last question, Hilly?
Thanks. So I just wanted to start by saying, oh, I'm sorry. You okay? Okay. Just wanted to start by saying that I think what you mentioned on the forums in terms of changing things like next of kin is awesome. As a communications professional, I think that we spend like a lot of time administrating administration, and so making it simpler for people is excellent. I'm curious to understand how you ensure that your engagement is targeting the right people and getting the right feedback. So I know you mentioned the example of the library. If people are already not coming to use the service that you're offering, how do you know that the people you're reaching out to for feedback are the same people that are going to come to the library and use the service?
Yeah, so, well, with the Art Gallery Museum and Archives, what we actually did was we had to start putting Facebook ads and really utilizing social media to say, hey, have you ever heard of us? And if not, why not? And why have you not come here? That was something where it was just we paid for ads, put them out, and we got so much information back from people who had never even, we're right in the heart of Brampton. You will have seen the building, so why weren't you coming? And we gleaned such great customer insights from that. You have examples? Yeah.
Yeah.
Okay.
Stick with that. Yeah.
But yeah, it's reaching those audiences that they don't provide feedback, and incentivizing got us huge returns on the investment because again, we got those amazing insights from people who had never stepped foot in the building.
And maybe collecting little bits of information as part of the service journey. We try not to over-collect, especially socio-demographic, but maybe just something to help us determine if we are reaching communities, even if it's the first 3 digits or characters of a postal code.
Yeah.
Not everything, but just one thing for that purpose. We've done that.
Thank you for that last question. And one takeaway you had on your slide was empathy is practical, not ideological.
Absolutely.
And I think at the end of the day, that makes us more effective and more efficient overall. So thank you very much, Renee, and thank you, Andy.
Thank you.
Thank you.
Thank you.